Welcome everybody to the Health and Wellbeing Board today. We've got a slight change to the agenda, so we just moved a couple of items around. We'll be having the meeting in public, and I'm going to first off start with introductions, and then we'll look at what items we've got coming up in what order. So if we just want to start here, we've got a couple of observers today with us.
Hi, Jo Hilton-Jones, Public Health Manager.
Hi, Mariam Sajid, part of Public Health Trainee Practitioner.
Welcome to the team, Miriam.
Hello, I'm Jay Brand and the Deputy Chair of this board.
Liz Towns-Andrews from the University of Huddersfield.
Councillor Carol Patterson, Leader of Kirklees Council.
Rachel Spencer-Henschel, Director of Public Health for Kirklees.
Lucy Wearmouth, Head of Improving Population Health.
Melvyn Ingleson, Chair of Health Watch Kirklees.
Steve Brennan, I'm the Director of Partnership Development for the West Yorkshire ICB for Kirklees.
Liz Mear, Chair of the Kirklees ICB Committee. Hi, I'm Catherine Riley, Associate Director of Strategy at Calderdale and Huddersfield Foundation Trust.
Afternoon, everybody. Michelle Cross, Exec Director, Adults and Health.
Hi, I'm Helen Duke. I'm Director of Operational Services for Locala.
Hi, I'm Jo Lawson, Chair of Health and Adult Social Care.
So, welcome everybody to today's meeting. Just to get the business out of the way, are there any apologies?
Yes, Chair, we've got apologies from Tom Brailsford, Stacey Appleyard, James Cregan, Alistair Brown, Karen Jackson and Brent Kilmurray.
Anybody from the floor got any apologies? No? So we receive those apologies. And the minutes of the previous meeting, do we have somebody who could second those as, move those as a correct record?
Yes, Chair, I can. Yeah.
And a seconder? Thank you. Has anybody got any interest to declare today? Great, and no deputations or petitions to the meeting. Thank you. Any public questions? No. Right, so we're going to swap around our midpoint evaluation for the Kirklees Health and Wellbeing Strategy with the Healthy Working Life Programme, just a direct swap. So in the grand scheme of things, except for those presenting, it doesn't change things substantially. But we are going to start with our regular update and ask if any of our members have got updates from their own organisations. Melvyn? Health Watch.
Thank you, Chair. Just wanted to give you a quick update. Some of you will be aware of this, some of you not. But you will be aware that Local Health Watch have a statutory role under the Health and Social Care Act 2012. We do a lot more than that, and I think it's about reaching deep into communities and amplifying the voices of those who are seldom heard, and indeed speaking truth to power. You might wonder what that's got to do with anything now when I'm talking about the 2012 Act, but the NHS 10-year plan has set out a new vision for giving power to the patient and enabling the public to shape services. However, alongside the 10-year plan, a probably now largely forgotten report was also published, perhaps a little confusingly, by the same Penny Dash, who is now the chair of NHS England. And that was a comprehensive review of 5 patient safety bodies in England, which Health Watch was then roped into, as it were, in terms of its role. And what that has led to is a decision by the government to disband Health Watch England and to move its role as a national champion of the patient into a Department of Patient Experience in the Department of Health and Social Care. It has also led to a decision to remove the funding which is received by local government to provide core funding to each local health watch, of which we clearly are one of many in England, and to pass responsibility for communicating kind of patient experiences to the ICB for Health, and as yet unspecified, the responsibility for patient experience in social care to local authority. The reason I mention that now is really twofold. We have been advised that the 10-year plan and therefore the other recommendations from the DASH review will require enabling legislation. That means that I have the challenge as Chair of Health Watch of maintaining the motivation of my very committed team and my volunteers until April 27, which is the latest time or the earliest time at which we believe the legislation will be passed. And that's advice from the Department of Health and Social Care. So there is a challenge there, and I think the issue for the board is how we wish to sort of consider the role moving forward of the independent voice that is so critical for service users. And in particular, it is critical for service users who are not confident with accessing or navigating the system. And that's where most of my team's time go, alongside the volunteers. So we would like to work through that as things become a little clearer, and to involve partners, and we will then bring probably a paper forward which kind of reflects on the importance of, and the need for an independent patient voice. And I recognise that that might not necessarily be Health Watch, or it may not be named Health Watch. And we would also then be likely to hold a fairly major forum in the new year when we want to try and understand how the system and the partnerships that are so effective in West Yorkshire, but particularly in Kirklees and Calderdale, how we could all work together to ensure that that independent voice is not lost. But thank you.
Thank you for bringing that, and it's really important we keep abreast of it. It's been very, not by luck, by hard work, but obviously been very lucky in West Yorkshire that we've had a very proactive Health Watch that's been very successful, recognised by all parties in health that they do a great job to bring that independent voice and the patient voice forward. Does anybody have any questions for Marvin or on the subject? I want to reiterate the desire that has been spoken out by the West Yorkshire health leaders, the portfolio holders across West Yorkshire for adult social care, public health and wellbeing board chairs, and you know, spoken to at the West Yorkshire Health and Care Partnership, that it would be our desire to retain an independent voice for patient voice, you know, whatever form that would take, and definitely not to take anything away from the great work that Health Watch has been done, but if change needed, it must be still an independent voice. Anybody else got any updates from their organisations? No? Moving on then. We'll come first.
Chair. Sorry, it's Vicky, I'm on screen.
Oh, hello, sorry, I haven't got you. There you are. Sorry about that, you're not on the big screen. Fire away.
Oh, I'm not. Two things, Chair. When I put my hand up just to respond to your previous comments and the update from Health Watch, and just to say it was West Yorkshire ICB board meeting earlier this week, which people can view because it was in public, held in public. But there was a lengthy discussion about the voice of independent. Having the independence and the independent voice of service users, and there was a commitment to carry on doing joint work both at West Yorkshire and across our places with Health Watch to make sure that they are a key member working with us to shape what that will look like for the future. So I just wanted to put that out there for people.
That's great to hear. That's great to hear, Vicky. It's good that they're being involved in that shaping, and you're going to be giving us an update on how that shaping's coming together in just a little while, aren't you?
I'm going to do organisational change in a little while, yeah. Just from a place perspective, Chair, the one thing that I did want to raise today was in regard to, I'm going to say, some of the unrest that we're seeing across the communities regarding some of the racism. And just to really reinforce that we're doing some really active work both at a West Yorkshire level, and it will be taking place across our places, to try and make sure that people recognise that we are anti-racist in the work that we do, and that what we are across West Yorkshire is one of the first places of sanctuary. And we're doing lots of work, and again at the board this week we did a series of videos and commitments that will be getting published from today onwards across our communities to really reinforce with our patients, staff and service users that this is the position that we're taking, because we want people to feel very supported in our communities locally about the work that we are going to be taking, and that we do work together, and that we don't tolerate racism whilst we recognise that it is out there. So we've got a number of things that are also going to be happening across our staff networks and our communities to support people. And we have set up what we call our We Stand Together page on the share board, which has got lots of helpful resources for staff. And we've started by today running a series of lunchtime webinars as well, where people can come and actually tell their stories, but also where we can help and signpost people to appropriate services. So just by way of an update, that was one that I really wanted to give us as a place update without touching on the organisational change.
No, that's great that you've tackled that head on and provided that support for staff, Vicky, because I think some people are feeling very impacted, and I think it's something that we all need to make sure that everybody knows where we stand in that position on it. Anybody got anything else? Just whilst we've got a little bit of time, I'll do a little update from Kirklees and the Armed Forces Covenant, which of course is very bought into people's well-being from our veterans. And yesterday we had our first, ever since long before COVID, the last time we all met together. The Armed Forces Covenant Board meets online now, which is great because some of the big operations like Op Courage and that work specifically with veterans have people based in York and all over, so they can come together for that discussion on a regular basis. But as I took over in that role, I insisted we initiate a meeting in person at least once a year, and we had a big networking event yesterday. I think there were about 45 people there, and then we had representation from lots of organisations, from Luke's Lads in Batley, and obviously Tommy's in town, the Rural Veterans Hub out Denbydale Way, and the Served out in Slathwaite, which interact with people on a very social and informal level, right through the DWP, who have special service champions who work specifically with veterans. We were also able to point to Kirklees having been awarded the employer's recognition now for Gold Standard, which means we're right at the top of what we should be doing, but it's only the beginning because we've really just planted people in every service now as champions. We're across the services, and we've got a network now for our veterans within the service who work for us, the families of service people and families of service veterans, so staff network there, and we're working forward with that. And another role we have is to also encourage other local employees to do that. So it really promotes good practice in services. Obviously people who work in our teams for adult social care will be well aware of sometimes people come with additional difficulties in accessing services, and just as you said, those who struggle to navigate services. By having a champion, that really helps, and I think it's great to embed the learning from veterans, because many other people might have those difficulties of how to navigate that system, not just veterans. So I think the learning goes backwards and forwards, but we're delighted to be able to announce that. And then we had a lovely afternoon of casual networking, having had some presentations in the morning, but it was a great success, and I think that's that one thing about the communications, backwards and forwards, knowing each other well, keeping those conversations going. So I was proud to be able to initiate that here in Kirklees, and we have a really good network to help our veterans, and we're constantly moving forward. So, having done all the updates, unless anybody's got any questions about how, the covenant or anything like that I've just raised. Right, we'll move on to item 8, and this is the midpoint evaluation of the Kirklees Health and Wellbeing Strategy. And this is going to be presented by Rachel Spencer-Henschel, who's our Director of Public Health and Deputy Chief Executive. I didn't know which title to put on you then for a moment, Rachel.
Thank you very much, Chair, and I really appreciate the switch to the agenda. I'm sorry about my diary clash. Okay, so today we've got a slide presentation that will hopefully bring to life the information that we've got in the paper. So this is kind of a midpoint assessment of the kind of strategy that we've got for Kirklees, our JAWS, or KHWS, always acronyms, which we launched in 2022 and is due to expire in 2027. And we've proposed a few next steps in terms of plans to refresh the strategy in preparation for its finish. So just as a reminder, the strategy has a nice diagram there which shows the board what we all agreed and signed up to in 2022, the vision, which I know you're all familiar with, and then those outcomes of Best Start, Well and Independent, which obviously go across our respective partnership, as well as that shaped by people, which is very much about how we make sure that we're working with people and not doing two. We had 3 priorities to achieve those outcomes: mental well-being, healthy places, and connected care and support. And obviously, over the last couple of years, you've had regular updates on those priorities into this board. And then we've got factors there which we use as kind of a lens to be able to look at how we're delivering those priorities. So we always look at inequalities and inclusion, and you'll have seen that come through on things like the annual reports that we produce. Shaped by people I've mentioned, we've looked at poverty specifically and obviously the impact of that on health and well-being. Digital and how we can use that more effectively to reach people. Looking at housing, because we know that people's homes are so important in terms of the factors that affect their health and well-being, and then how we're contributing to the climate emergency. So we did an internal to the council assessment. So I just want to make it clear that this wasn't a partnership evaluation. We've just done it at a first draft within the council office space, but obviously by bringing it here we want to be able to talk about whether other people have got any input into this and whether they kind of agree with what we've summarised. And what we hoped to achieve was whether the strategy was actually making a difference, whether it was on track to what we want to do, what are those priority areas delivering for us and are they the right ones, what's hindering successful implementation and what's helping it, and how can we essentially use the remaining period of the strategy to best deliver against that vision and outcomes. So the general reflections were that the vision remains relevant. I mean, I'm sure you'll all agree with me. Sometimes visions, they very rarely change, I think, but they can sometimes feel a little bit motherhood and apple pie. But I think, generally speaking, it remains relevant, and people have, it's been in place for such a long time now that I think people are quite comfortable with it. And I think particularly this board's focus on wider determinants and not just some of the kind of healthcare, public health is really positive. We've got some system-wide embedding of the strategy. A really good example of that is, for example, the poverty work that we've done even within our acute trusts, which is obviously quite unusual for acute trusts to be looking at, but CHFT particularly have been fantastic in that space. And then clearly the work that we've been doing alongside the university is really, really exciting and helps to bring kind of the education sector into health and wellbeing in a much more visible way. We've got probably a lack of clarity on some of the project management and delivery and accountability around the strategy. And to be honest, it's always hard with a strategy like this because it is such a wide-ranging strategy across the partnership that sometimes you do lose who's responsible for what. So we thought we could perhaps better strengthen that. Outcomes frameworks, our favourite thing. They tend to be very, 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 very long, and sometimes the outcomes framework relates to, if you talk about people being well or independent, you could have measures coming out of your arms, can't you, in terms of what we would look at. So we could do with being a little bit more measured about that and think about what are those key outcome framework measures that we want to monitor, and we could probably monitor it better within the Health and Wellbeing Board, not just the progress, but also how we're doing against that. And clearly through our refresh of the Joint Strategic Assessment, we do bring some of those changes back, but how do we tie that assessment to the strategy and the work that we're undertaking? Next, please. So we're suggesting that we need some clear leadership and governance of that strategy. So how do we use this board particularly, but also our respective organisations to look at that? Get that clear roles and responsibilities so that everybody knows what their job is in relation to it. Simplify the outcomes framework, as I've said. And then how do we update the language? Because I think, like most things, the language can be a little bit outdated, and particularly given we've used things like theory of change, etc. And how do we use some of that language within the strategy? And how do we deliver consistently against those three priorities? Because invariably, sometimes you focus on one rather than the others, so we need to make sure we're doing all of them. I think similar to obviously the update from Health Watch earlier, we need to really ensure we've got community voices built in to the strategy, because we're not going to know if we are making a difference unless we've actually got people talking about it. And I know we do that in some cases, but we could be more consistent with that, I think. Mental well-being is so key to everything that actually, rather than it is a standalone priority in one sense, but we also need to make sure we're using it as a focus lens as well, because it does have such an impact on all of those other priorities. We need to think about healthy places delivery, and in terms of how that links to the new changes to the NHS and the move towards neighbourhood models. How do we use that language more consistently and help use the kind of direction of travel of the NHS to achieve that healthy places delivery? Obviously, Vicky has mentioned, and we'll come on to some of the changes around the NHS. And, I know that this board has talked before about how we use this as an opportunity to get our strategy right and to get it in being delivered in the right way for our population. And that obviously applies to the 10-year health plans. And actually, if you cross-check between the 10-year health plan and our health and wellbeing strategy, it is quite consistent, which is good. I would hope it would be, but clearly, there's a bit more work to do to align those things. So what we've suggested is that we kind of, rather than start a refresh now, we have a bit of a pause. And I think that's particularly because there's so much uncertainty about what the role of the Health and Wellbeing Board will be in neighbourhood delivery, how the local integrated care system will be set up, that it feels like the strategy is not broken, so let's keep it as it is, but then come back in 6 months with a proposal once the dust has settled a little bit and we know what we need to do. And once we instigate that refresh, we would like to do a bit more of a comprehensive evaluation to be able to genuinely see what we need to do differently next time, and how that we make sure the next strategy over its 5-year life genuinely does make a change to our population. So 6 months is the plan to bring that back if the board is happy with that as an approach, and obviously I'm really happy to take any comments or questions or any observations from anyone else that's been involved in either this board or the strategy work. Thank you very much.
Thank you, Rachel. Anybody got any questions, queries or thoughts as going forward? I mean, we're in that sort of tentative moment where it's coming, but all thoughts could be valued and put on, on track for that refresh. Vicky, hello. Sorry.
Thank you. So I've got a couple of comments because I've also got, in my update, my organisational change update, I have got something about the planning process for the ICB, which very clearly links to this work specifically. But I think going forward, there's some key things for me. One is we've got to make sure that we've got that really key link with the integrated neighbourhood health and what will be the integrated neighbourhood health plan, so that we're at least saying the same thing, moving in the same direction, and they are complementary and they don't pull against each other. Totally agree with what Rachel said about having measurables, metrics, whatever we want to call them. I'm really keen on metrics as well. And one of the things that we do know from a West Yorkshire ICB perspective is that for the integrated neighbourhood health plans that we're going to have to do, we will need to tie those back to what they're calling the North Star metrics. So I think, again, for me, it's about us making sure that whatever those metrics are, and whatever we end up calling them, whether the North Star metrics or wellbeing metrics, actually they're saying, again, the same thing. So we've got a degree of consistency across our footprint for that. And I think the language is going to end up being really important, as Rachel has said, that we all know that there is very little really changes in everything we do. It's just that there's different plans and they come up with a different set of language and buzzwords. So we've got to A, make sure we are reflective of that, but B, that it means something to us at place. And by place, I mean across Kirklees. And it's not just us as professionals, but also our population, so that we talk in language that they can understand. And part of our jobs then becomes that interpretation to write the narrative back to the centre, etc. So we've done it in a way that they recognise as well. So I think they're the key things. I totally agree with what you've said, Rachel, about the timescale. So I'm really supportive of that. The one bit that I do have to say is that, however, is that there is an expectation that we will be drafting the neighbourhood health plans in draft by the end of November, and then in detail by the end of January. And there is an expectation, and we would want to be able to bring that back through the Health and Wellbeing Board. So I know the discussions that we've started already include all partners, including our local authority colleagues, public health colleagues, to help us shape that. And looking at how we laid things out last time for the Kirklees Wellbeing strategy, I think it should, and we can make it slot in quite neatly. So it could be part of this is written in, I'm going to say, in advance of when we start it, but we make sure that we lift and shift that into the Kirklees Wellbeing plan, so that we, again, not duplicating a piece of work, and we're maximising that input at that point, if that's agreeable to people, just because of the differing timescales that we're going to have.
I'll let Rachel come back on that, but we do need to look at that, Vicky, because if you're coming in draft in November and expect to be finalised by January, we may have to convene a special health and wellbeing board to specifically look at that, because our next actual meeting is in January. But more than happy to facilitate that, because it's such an important part of how we move forward. And I think as a partnership, we ought to be looking at that, especially, the neighbourhood plans are very much at the heart of how we interact with you as a health service.
Thank you, Chair. Thank you, Vicky. Really, really helpful. I think, interestingly, when the 10-year plan came out and there was a suggestion of health and wellbeing boards being responsible for kind of overseeing the neighbourhood plans, I think there was a little bit of panic from public health about, that's not the same as a health and wellbeing strategy, and we do need that health and wellbeing strategy because that's got to cover all of the determinants of health. And as you say, the neighbourhood plan will be a bit like the health and care plan if its previous iteration, isn't it? It's almost like the kind of implementation. So I completely agree with that, and really happy to be involved wherever in terms of getting that right for Kirklees.
Do we have any further questions, comments? I know we're in a bit of limbo going forward, aren't we? Because we're sort of balancing and waiting, Steve.
Yeah, thank you. Mine was just an observation, I think, really, because I think the current version of the health and wellbeing strategy is really good. And I think it's probably the third iteration I've been involved with, not in writing it, but in terms of trying to help us implement it. And I think there's always an element with these where it's a bit of an art and a bit of a science, isn't it? So yeah, the science is the alignment of other plans and the metrics and so on, but then the art is kind of winning people's hearts and minds. And I think we've done a reasonable job of that in the system with this, and how it kind of leads into other areas of work that we do beyond just a health and care plan. So things like when we talk about the Healthy Working Life programme later on, I think you can see how it's influenced that around joining up some of what we're trying to do. So it's just that reflection that it's beyond just a health bit of it, and that I think is really important just to bear in mind as we do the refresh.
Yeah, I think where we mesh together is that overarching well-being. You know, there's very specifics about health, and there's very specifics that sit with the council, but where they overlap is bringing together well-being. There's a couple of things that Rachel's brought to us there that really sparked what we've talked about in our development sessions. The neighbourhood working and co-production go hand in hand, because nobody knows our actual neighbourhood at Kirklees, but neighbourhood as those real small areas that things are being drilled down to. Nobody knows those better than our residents, and I'd like to see that really collaborative and co-productive element to what happens in their specific areas, and some of that is to speak to the overarching interventions that will come from elsewhere, like from health and that, into there, because we can make a blueprint for people, but we need to make it with people. And the other thing is the partnership that we have here. So I'm really working on strengthening our board, because health and well-being doesn't sit in health, it sits in our communities. So I'm trying to bring in some business partners for us, because regeneration and business is absolutely crucial to how our residents feel about where they live. Healthy places, lovely concept of healthy places, but bringing that down, and as Carol, our leader, has set our priorities with us this year, going forward, getting the basics right is really core to that, and we're working forward strong on that, and that's a really wonderful way to give people some pride in the place. But partners go with the university. I see as a very creative and innovative partner for us, and you didn't mention, but we did. I was there at the launch of the Huddersfield Health Innovation Incubators last week just, and obviously that's fantastic that we've got such strong stuff coming forward in our own patch from Huddersfield University, leading the way, not only on health innovation, but all sorts of creative ways of working. I know you're working hard in your business department on very creative ways of working with people with diversity and need in that area and stuff like that. So I think we need to keep our comms together about what we can all do together, and make sure we overlap. And another thing that you've brought up with the health hub is data sharing, and being able to work to those facts, to that stuff, because where we can't always collaborate and get that information, we've got really deep dive information right across the council and yourselves, and working with that together. So co-production between partners and with our community sits at the heart of it for me, because those healthy places is a place where I see us being able to move forward with the neighbourhood working alongside the health. How's that sound with you, Vicky, working alongside on the healthy places?
Yeah, definitely. That's where we need to be going.
That's great. So, any more questions?
Really, it was to follow on from Vicky's comment about the integrated neighbourhood element and how we factor that all into the plan. I mean, Vicky knows because she visited last Friday, so, but how are we going to, how can I put this? How is the West Yorkshire piece on integrated neighbourhood, the pilots that have got approved in Wakefield, Leeds and Bradford in this first wave, how are we going to learn from them or use those or collaborate with those local authorities to actually inform what we do, or rather than just doing I know we have to do what's absolutely right for our place, but there are 3 pilots running. I suppose how can we benefit from that? That's what I'm trying to say, really.
I'm not entirely sure if that sits right here and now, or maybe with the update that Vicky's bringing, but if you want to come back on it, Rachel. Okay, bring it in now. We can merge together, it doesn't matter.
Do you want me to answer that question?
Unless you want to bring it in when you do your update, Vicky. Was it better sat there?
I hadn't specifically touched on the pilots, if I'm honest, in my update, so I will do it now. Really, it's to give the committee assurance that whilst Leeds, Bradford and Wakefield put the bids forward and Calderdale and Kirklees didn't, that was down to the very specific criteria that you had to evidence to put your bids forward. Each of the places, including Calderdale and Kirklees, are moving at pace on the integrated neighbourhood health, integrated neighbourhood team development. And there is a very clear direction of travel and a document guidance set of notes that people should be following. Just so that people are really clear, those that are pilot sites haven't been given anything additional. So it's not like it came with any money or anything to support them to be able to do the work. It's just that they've got to report into a central body now so that that learning can be shared. And also for them, it does mean that they've got some specific asks that they've got to move at quite a pace to be able to deliver. For example, digital and monitoring are two of the real key elements that they've got to move at pace at. Across West Yorkshire, what we do have in place is a collective board, integrated neighbourhood health board, that has representatives from all the places. So we were already that was already established, and we were already sharing thinking, learning that every place was doing. And we do monthly updates into that board, as well as then into the ICB committee formally, regarding the progress that we've got on INH as well as other areas. So that learning will be taking place, and we will get that in real time. And that was part of the commitment, that we might not have gone wave one, and we may well go for a wave two if there is a wave two opportunity, so that the whole of West Yorkshire are involved, but that we would be taking that learning and moving at the same pace as the other places, even though we weren't an official site. So hopefully that gives the assurance. And Catherine Wormstone and myself are both on that West Yorkshire board from Kirklees.
The right people to be there. You've got all the oversight, and you can bring it back to us, Vicky, to hear, can't you? So anybody got any more questions? Anything else to comment? And I keep looking down here. Sorry, you're behind me on the screen, Vicky, so I do apologise that I keep forgetting about you when there's something on the board. So we are due to have a short break right now. We're finishing a little early for the break. So I would suggest, can we come back for about 25 to? Chance to get a drink and pop to the loo or anything like that, comfort break. Thank you. Welcome
I'm
back.
ready anytime.
Welcome back, everybody. So, for the next part, we're going to go first to Vicky Ditchburn at the ICB to tell us about the changes to the Integrated Care Board, the landscape.
Thank you, Chair. So firstly, before I start, I just want to apologise.
We're here.
All right, I'll carry on. There isn't a presentation this time due to the fact that the landscape has been changing quite rapidly over the last week. So there is some information that I'll be sharing today that is quite hot off the press. And it is a different position to last time that we've had. So people will recall that last time when we met, I went in quite a lot of detail about the organisational change for West Yorkshire and the impact that would have for Kirklees specifically. Just by way of context to remind people, there's some really key missions that the government have set out for us. So that the first one is that they're looking at the cross-governmental work for health completely, and there is going to be significant changes across the four key elements that deliver health services, including the Department of Health and Social Care, NHS England, regional bodies, as well as local ICBs. We've also got recently the 10-year plan for the NHS has been published, and on top of that there are some reforms for adult social care that have also been included. There's three main shifts for care that we need to be aware of from the 10-year plan, and that is the drive from treatment to prevention, so that brings in the neighbourhood health work, hospital to community, again linked to neighbourhood health, and then analogue to digital. So I am going to touch on each of those as I move forward and just talk about some of the changes. Last time we discussed in quite a lot of detail the pace that we'd been asked to move at to design new structures to deliver the proposed functions of the ICB. And people may recall that we were given the mandate at the beginning of April, and we had to, within the space of about, I think it was 8 weeks initially, we had to have draft structures to meet the new functions to be submitted to NHS England, which we did as West Yorkshire. So we've hit the required milestones at that point. I think what is very fair to say that is we'd identified that there were these four key components, as I've just mentioned, that all have to change across the total national health system. But the only blueprint that had been issued at that time for us to consider was what they were expecting of a future ICB. So designing those structures had been done in a degree of isolation and not knowing fully what was expected of the new regional and new national parts of the team. However, we did do it and we submitted for West Yorkshire so that could be considered. So where we've got to now, I think it's fair to say that last time I did draw people's attention to, it was a significant change because we were talking about a potential staffing reduction of 50%, which we had to be ready to start implementing from October this year. And also that there was a big question over how any redundancies would or would not be funded. So as I move forward today, I am bringing you up to speed with that information. So where we're at regarding the redundancies now is that there still remains a lack of funding for any redundancies this year. And that is national. So we know from Sir Jim Mackey that it was never planned for at a national level to fund any redundancies. So We now know that it is very unlikely that any funding will be coming down from central to ICBs, and that we would be expected to fund it within our own resources. And that is if we go now or at any point in the future, as things currently stand. So we also know that we cannot manage this this year, and that's not just us as Kirklees, that is the position for West Yorkshire. The biggest driver that we have got from the national team is that we've got to meet our control totals, and because this came out after we'd submitted our plans for 25-26, we've never included redundancies in the budget, so there's no way that we can do that for this year. But what we are now aware of is that we will have to consider this as part of our future planning assumptions for 26-27 and going forward, within whatever our allocation is once we are made aware of that. So based on that, West Yorkshire have taken a decision and notified the West Yorkshire Board on Tuesday that we will not be proceeding or conducting our formal consultation on any staffing reductions or new service configuration until next financial year. What I do need to say is, and I do need to put a caveat on that, is there was a letter issued by Sir Jim Mackey earlier this week, and he did say in that letter that there is still ongoing discussions with the Treasury that conclude within the next 2 weeks. So there is a very small possibility, and I'm saying very small because their position, as I've said, is that they're not going to fund any redundancies, that the position may change. But based on what we do know, and I suppose a risk-based approach, we have now informed staff that we won't be consulting until April at the absolute earliest. So we recognise that this is quite a difficult decision that we've had to take, and it's also a difficult message that we're having to share with staff, both in Kirklees and across West Yorkshire. But it does give us some opportunities by moving these timescales. So it will allow us the opportunity to better align the changes to the ICB functions and structures. And it gives us the opportunity to do much wider engagement on a number of different levels, including with the proposed regional teams and their blueprints once they're fully published, the NHS England team, and all our local providers about what that might mean and how we can move forward. It's also giving us the opportunity to put our existing resource, as in staffing, etc., behind some of those priorities that we've identified for the rest of this year. So we do know that we have to manage winter. We have to manage winter every year. But one of the things in the original blueprint was that the regional team were going to be more proactive in delivering winter plans. However, that has been passed back to local ICBs. So it does mean we'll have the resource to be able to do that. It also means that the expectation to develop 3 and 5 year strategic plans will also have the full complement of our planning teams to be able to support the delivery of that piece of work as well. So they're quite key. So as it been a disappointing message that we've got to do, and it sort of extends that period of uncertainty, what it does do is give us the opportunities to carry on doing our key pieces of work over the next sort of 6 months. And some of those areas have been identified within the 6 priorities within the 10-year plan, as well as we've just said, doing the planning work, the strategic planning work that we've got to do. So they're the key things that we're going to be working on. What we will also be doing over this time is considering the model region blueprint as that comes out. So we've had a high level copy of it about 3 weeks ago, 2-3 weeks ago. And what was also issued at that time were some good practice guides. So people will recall that one of the things I took us through last time was that there are some functions that would temporarily stay with the ICB, such as safeguarding, continuing healthcare, but meds management. But at some point in the future, it had said in the ICB blueprint that these would move to other providers. What it's allowing us to do now is to work with our providers, and especially given that we've got the regional blueprint, to refine some of those plans and engage slightly wider than we were able to do when we had that rapid timescale. In and amongst that, what we also know is some of the timescales have slightly changed. So, for example, continuing healthcare, we have now been informed will be staying with the ICB for at least 2 years. So that means that there's a degree of a surety there that we have got time to make reasonable changes and hopefully get a better model out of the work that we're going to be doing. Equally, they've been a little bit more clear on some of the roles they expect for meds management and also for safeguarding. So the proposed structures that had been designed can now be re-looked at against those blueprints and amended accordingly. So this is really important regarding the finance, the oversight, some of the workforce issues that we've got. And like I say, it gives us much more opportunity to engage with all our partners regarding the elements that would be potentially transferring much further down following legislative changes, and making sure that to some degree we can co-design those to make sure that they are the best models we've got. To do this, we are going to be revising our communications plan. So I think I've shared on a number of occasions how we are communicating and keeping staff engaged as we've moved forward. And we will be changing some of this slightly. We've always said to staff that there was no point in us having a weekly or a 2-weekly briefing if we actually were just turning up to say there's nothing new to share. So we're going to change some of those communication briefings, still having at least a monthly meeting so that we can keep business as usual and try and keep staff motivated, and also put much more in the way of face-to-face meetings and workshops to be able to have those conversations with staff about making the changes and the alterations and refining those models that we've talked about. We will be maintaining written updates to all staff and ensuring that all our staff and partners receive those written updates, just like we have been doing as we've moved forward. And there'll be regular meetings maintained that we've already put in place with our partner organisations and NHS England to make sure that that communication flow is maintained, but that people feel involved in the work that we're doing. So we will be maintaining things like the West Yorkshire Transition Partnership Board and the development sessions that we've been running to do those pieces of work to make sure that it is as robust as possible, and that we've also got as much of the safety for any future transfer built in as we need for that. So as partners across Kirklees, we will continue to keep people informed through those various mechanisms, but also through the briefings that I do with the chief execs, and also the development sessions we do through the ICB committee to make sure that people are kept up to date. And if things change, we will schedule in additional briefings and updates, etc., to keep people updated. And I'll continue to come, obviously, to Health and Wellbeing Board and bring verbal updates as required as we do that. So that's the key thing regarding the organisational change that I wanted to say. Two other things that I wanted to just touch upon that are linked is obviously we do have to do future planning. So we're expected to be doing a 1-year operational plan and a 3 and 5 year strategic plan that I've already mentioned. We are still awaiting further detail on the content that they expect us to include in those plans. But we've already started opening up the discussions and setting up groups with partners to be able to collate the information that will be included. The key bit of that, as I've already briefly touched on earlier, is the response to the 10-year plan and our integrated neighbourhood health plan. So I think it's worth us just noting that we've already within Kirklees got some really good examples of how the work that we were already doing and progressing is in line with that strategic direction of travel. So integrated neighbourhood health as a concept is something that we've been working to in Kirklees for at least a decade that I can recall, along things like our some of our integrated teams that we've got between local authority and locala, some of the work that we've done to bring services out of hospital into communities, how we've been developing primary care and working to all intents and purposes with or within integrated neighbourhood teams based around our primary care network footprint. So this isn't new, but it's building on that and further developing it to make sure that we deliver that care through that preventative, person-centred way that we've been doing in our communities to ensure that we add high quality, integrated and efficient services. As we mentioned earlier, there are 3 places across West Yorkshire that have been successful in joining the National Neighbourhood Health Implementation Programme. And as I also said, we've already got a West Yorkshire board established, so that learning will be spread and adopted across the whole of West Yorkshire. And also, as I said, there is very clear guidance about what that needs to include. But what we are also clear about in West Yorkshire is, whilst the concept is the same and some of the metrics may well be the same across West Yorkshire, how that gets implemented may look different in each of the places, because we are all individual places with unique populations that we've got to be able to address. Within Kirklees, we do have clear plans for the neighbourhood health, which includes the 6 core service components, and that has been developed in partnership, and we've used lots of opportunities to engage with partners to be able to further develop that. And I think it's fair to say that each of our PCN network footprints that these are being based around have got a good degree of consistency, albeit the pace is slightly different in each. But certainly by September next year, we will have fully operational integrated neighbourhood health in all of health teams in all of those 9 places. What we have also been doing on that work is identifying the priority cohorts of patients based on our population mapping that has been done to support our priorities. And we have agreed some really, I'm saying, high level metrics that tie back to West Yorkshire that will be measurables that show that we are doing that preventative care, supporting people out of hospital and having an impact on the number of people who actually attend hospital. I think it's fair to say that the speciality groups or the patient groups will be different for each of those neighbourhood health teams depending on what their priorities are. So some areas it's very clearly elderly, frail people with respiratory conditions, but we do have a couple of places where their biggest issues and I suppose highest attendance rates are around children and young people. So whilst the high level metric is the same one, the actual area of work people are working on is very personalised to that that team that are going to be doing the work and where people are living. The other key element of the work that we've got there within this as well is the development of formal arrangements for what will become the new provider collaboratives, provider alliances. So we've started that work across Kirklees, and again there's been some development sessions to support that. And we've got multiple partners involved in helping us shape that. At the current time, we've got a design group that are helping to do that work, and that's a multi-partner membership for doing that work. So we've got representatives from the third sector leaders, from different elements of primary care, some of our statutory services, our independent sector and care homes. So we've got a wide group of people helping us do that design work. I think it's fair to say that in the work that they're doing, they have taken an approach whereby they're leaving their organisational lanyards to one side when they start this work, and they are trying to work for the best of Kirklees and as partners of Kirklees, recognising that those individuals that are helping with the design work won't necessarily be the individuals that sit round a formal board in the future, but the partners will be represented. We've agreed terms of reference to get us the design work undertaken, which will hopefully get us to a position where we will be able to recommend a shadow board potentially from April, though we are thinking it'll probably fall into some point of Q1 next financial year. We have a work plan for that group that is doing the mapping of what will be and won't be potentially included, so that we can get the appropriate legal advice for changing the statutory functions. We have established a mechanism for communicating, which is being tried as of this week for the first time. And we have a very clear work stream regarding governance work that needs to take place. So that's quite a key piece of work that we're taking. Within the planning work, as I mentioned earlier when Rachel did her presentation, there is an expectation that we develop the neighbourhood health plan, which will be about supporting our place-based delivery plans. And what we've recognised is that we've probably already got the bulk of this information between us all anyway. So, for example, we've already got the Kirklees Wellbeing and strategy that we've talked about. We've got the JSNA. We've already got a whole host of delivery plans, including the integrated neighbourhood teams work that we're doing. We've got our Better Care Fund plan. So we've got lots of work that's already there. So we're going to draw on that to pull as much of the information together from that for two reasons. One, we don't want to be redesigning and starting from scratch. Some of those plans have been updated quite recently. So, for example, the Better Care Fund gets reviewed and updated annually. So it's drawing on that information that we've already got. But we will be working with partners to be able to do that. And I believe that some of those meetings have already started to be established to start reviewing that work, partly because of the pace that we've got to be able to move at. Within that and drawing all that together, obviously there is looking at the metrics, as we've mentioned, and West Yorkshire ICB talk about North Star metrics. So we're going to have to make sure that the metrics are at least triangulated to be able to do the work. We will need to pull in the work that we've done to understand demand and capacity, not only within our hospitals, but across our local populations as well, so that we know what the needs of our populations are, right from those that access acute services through to community services, through to our social and and when I say community-based services, those that are not statutory services as well. I've said about us working collaboratively so that we can build this in detail and do the operational plan, and move forward on those existing elements that we've got. So that's the work, and as I've agreed with the chair, we will set up some dates to do it and present back. And finally, the only other thing that I wanted everybody to be aware of is linked to the organisational change. People will have seen in the press this week and last week the pressures at Leeds Teaching Hospital NHS Trust. And some of the proposed changes to help mitigate that will have an impact on us locally. So I think it's just worth us being cited that Leeds have got a new chair in Anthony Kildare, and they have appointed a new interim chief executive, who is Brendan Brown, who was the CHFT chief executive. And to support some of the reports that have come out this week, so for example the CQC report that came out earlier this week saying that the trust required improvement, etc., there is work ongoing across the West Yorkshire ICB about where there are potential staff that we may be able to second to support that work, especially while some of the new posts are permanently recruited to at Leeds. But it's just to reinforce with people that this is in line with the system's role about being visible and demonstrating how we work together as West Yorkshire to support the whole West Yorkshire system. And it's not about preempting any of the future changes that we may be doing. But I think it's worth the committee being aware that there will be some potential impact, and as more information comes out, we will share that.
Thank you, Vicky. Such a huge amount of change even from the last time you updated us, and I don't think anyone here is envying you the pace and breadth of delivery that you've got to put in place. But I really would like to welcome how positive and that you've been able to be through this, how you've found the positives in the changes and in the things that you can work with, where things have moved even within that change. And I'm sure you're passing that on to keep your staff motivated. I'm sure people may have some questions, but we're going to take the next item first. Vicky, you'll be with us to the end, won't you? So we can maybe take a couple of questions and comments at that point. So right now, I would like to bring in a really exciting new work that's going on in Kirklees, and where we are working very much in partnership and in the community. This is the Kirklees Healthy Working Life programme.
Brilliant, thank you very much, Chair. So I'll just kind of briefly introduce this item, then I'll hand you over to Jessica, Alison and Phil, and they're going to kind of work us through the presentation. Mainly, Phil's going to take us through that. What we're going to try and do in the presentation is bring the report to life a little bit for you. So there'll be a little bit of background, there'll be some detail about the schemes that we've got in Kirklees and how they all hang together. So I'll hand you over to the team now. I'll let them introduce themselves separately, and then we'll start to take you through the presentation.
I was hoping to talk a bit longer then. Hi, my name's Phil Longworth, and I'm now working as the Programme Manager for the Healthy Working Life programme. Do you want to just...
Yes. Hi, I'm Jessica Taylor. I work for Fresh Futures, and I'm the Young Adults Employability Officer.
Hello, Alison Porter. I'm the Employment Lead within the Employment and Skills Service at Kirklees Council. Thank you.
Excellent. So I've got a few slides. We submitted a report that we tried to keep the cover report brief, but there's quite a lot of detail there, so I've no intention of going through all that detail again. But just to give you a bit of background, because I know some people do get a bit confused because there's lots going on in the health and work arena at the moment. So the government produced a white paper back in November 2024 and identified a range of things that need to happen to try and increase the number of people in work who've previously been out of work because of ill health, and also increase the support for people who are in work who might be at risk of losing their job because of ill health. So there's two things currently: the Health and Growth Accelerator, which has been led by the ICB, and the Economic Inactivity Trailblazer, which is being led by West Yorkshire Combined Authority. We're trying to deal with those as a single entity as much as we can. The good news is that even though we've only got money confirmed for this financial year, there was specific reference in the NHS plan to the accelerator, so that gives us hope that there will be some continuation to this approach and the money coming through the ICB. And similarly, the Trailblazer was referenced in the spending review, and again that gives us hope that funding will continue beyond this year. So, we've been working on it since April 2025, and it was, to be honest, from a standing start, and we're now at the point where implementation is happening, and one of the reasons Jessica's come along is Jessica works for one of the schemes that's actually delivering support to young people. So she'll talk us through a case study later on. I'm not going to go through the stats because they were in the report, and but basically one of the main reasons that this work exists is because it's recognised nationally that there's an issue around work and health. And the reason why West Yorkshire was picked is because it's one of the areas that's got the highest rates of unemployment due to ill health. So there's a reasonable amount of money. The challenge with the money, as I've sort of alluded to, is at the moment it's confirmed for this year. As it said on one of the previous slides, we know it's been confirmed for Trailblazer for next year, but exactly what that's going to look like, we're not quite sure. Still haven't got any confirmation around the accelerator money. A few more figures just to give you a sense of the scale within Kirklees and some of the issues. Again, not going to go through the detail, but we've known for a long time that the issues that are actually affecting people's ability to work are mental health, musculoskeletal, and what they term cardiometabolic, that's heart problems. Quite why we can't all decide what to call it and stick to it, I don't know. But anyway, one of the things that we do know, though, from work that's been done in the past is there used to be sort of an even split between mental health and musculoskeletal, but that's changed significantly, and now around about 40% of the people who are at risk of losing their job because of ill health or are struggling to get back into work because of ill health, that's due to mental health issues. So that is very much a growing issue. And again, just to pick up on that theme of growing, one of the things we do know is, whilst sort of understandably because of the nature of the conditions listed on the right-hand side, the greatest numbers of people are in the sort of 50-plus age group. The group that's growing fastest in terms of people who are not in work due to ill health is actually young people, 16 to 24 years old. And one of the things that we're doing in Kirklees that's a bit different from the other bits of West Yorkshire and the other two areas where they've got accelerator funding is we've got a strong focus on young people, which means that as I run through in a minute the schemes, you'll see there's a significant amount of work going on with that group. Just the only thing I want to highlight on here is that out of the people who are not currently working, who are classed as economically inactive, 1 in 4 of them, it's because of long-term ill health issues. So, this is a slide that lots of people have found quite useful because we've tried to summarise on a page what are we actually doing to help people. So what I was going to do is canter through these very quickly. What we've included in an appendix to the report is the text from a web page that's now up on the West Yorkshire site that basically details what each of those schemes is doing and who it's targeting, and has got a link so people can click through to find out a bit more information if they want. And each of the schemes is developing their own sort of materials to communicate to their target group what the support is available. So, like I say, I'll go through this quickly. So, Kirklees Active Leisure, CAL, are basically expanding the exercise on referral schemes that have been running for a long time, but doing it so there's a particular focus on fitness in relation to work. So that's both for people who might need to get a bit more active so they feel confident to go back to work, or people are at work who might need to get a bit more active to stop some of their health issues progressing, so they have to leave work. Locala are running a wellness to work, they're calling it, but it's basically employing some specialists within their community health teams to look at people who are already in contact with Locala, who might benefit from some bespoke support around work and health issues. So the university is involved, and Liz knows, I think, quite a lot about this because it's operating out of one of their fantastic new buildings. So it's Get Set Goal, which is a scheme that's actually run by the students, it's delivered by the students, and it's actually providing support to people in workplaces around health checks and coaching. So it's actually doing both training the next generation of healthcare practitioners, so nurses, physios, OTs, people like that, but also actually delivering a service to local businesses. Third sector leaders, as the umbrella organisation for third sector organisations in the borough, have got some money, and there are two elements to that. This is one of the most complicated to describe, so I might be doing it a disservice, I warn you. So we've got an established set of community anchor organisations. So they're working with the community anchor organisations to develop a specific focus around work and health in what they're doing, but also working with a wider set of third sector organisations who are going to employ key workers who can actually do that hands-on work with individuals to actually talk to them about their aspirations about work and health and help them find the support they need. There's a couple of schemes that are actually building on an existing offer that exists locally. So South West Yorkshire Foundation Trust have been running an individual placement and support programme, which is a national programme for people in secondary care mental health for a while. And this funding is going to enable them to broaden that out to operate in primary care. So that means there'll be a wider spectrum of people, not just those who've got to the point where they need secondary mental health care. Using the same model, Change, Grow, Live, who are our provider for alcohol and drug misuse services, they've been running a very successful version of individual placement and support for all their service users, but what they've noted is that there's been an underrepresentation in opiate users, so there's some money there for them to focus on opiate users and providing them with support to return to work. So moving on to the sort of children and, not children, no, we're not sending children to work. Moving on to young people. Oh, excuse me. So the college, as the main provider of, further education, have already got health and wellbeing. Oh, thank you very much. It's nice to be looked after. They've already got a range of services to support the health and wellbeing of their students. This is going to enable them to augment some of those and build some new things in, particularly about how to put health and wellbeing into the curriculum, but it's also helping them make sure there's a single, thank you very much, a single front door for health and wellbeing support for their students. So, Fresh Futures, rather than say much about that, Jess is going to say something about what they're doing shortly. Careers are also actively involved, and there's two elements to that. My Way Forward is about supporting those young people who aren't clear what their future does hold and helping them make choices, bearing in mind any health conditions that they might have. So that's augmenting the existing sort of virtual support that's available with a lot more focus on face-to-face, one-to-one and small group support. And Careers is also doing some work with those young people who've already are already ready to make that step into employment. They're either waiting to go to a job or in an apprenticeship. And this is, again, a way of keeping contact with those young people to make sure that their health and wellbeing issues aren't putting their sort of probably their first employment and their apprenticeships at risk. So, as well as that work which is with the sort of the overall Kirklees working age population, there is some specific work going on with the health and social care workforce, because we know that health and wellbeing is a risk factor for people leaving the health and social care workforce. And there's 3 elements to that. First one's about fast-track access to musculoskeletal support, which is basically physiotherapy. Fast-track access to mental health support for those people who are struggling with their mental health, and increasing occupational health support to those organisations that have not already got it. Because obviously, if you work in one of the bigger organisations, they've got occupational health teams, but if you work in one of the myriad of smaller, particularly social care organisations, that's not always available. So, final thing is there's a couple of digital tools that we're looking to test out. So, Cora Health, who run our pain management service, have also got a national offering around digital support for pain management, which they call Flipping Pain. So looking to build that out and make that accessible to more people. And Swift have got a digital-based offer around creativity in health that they've been running since the beginning of this year, called Create and Bloom, and we're putting some money into that to try and make sure it's embedded more into the way that we support people with mental health issues in Kirklees. So, having said all that, Jess is going to talk about a real example and a real experience of what people are, what's happening for people.
Thanks, Phil. So just to touch on, so I work at Fresh Futures based at Brian Jackson House. We run the 18 to 26-year-olds Elevate programme. So we've got sort of 2 strands from that. We run the Connect group, so it's a social group, building on confidence, and we run wellbeing workshops, holistic workshops, and then we've also got the Work Ready programme, again building the confidence to get the young adults out to feel confident to look for work. So I've just brought a quick case study. So A attends the Elevate Connect group on a Monday and Wednesday and was referred by her parent. When A first attended, she came into reception with her mum and found it hard to leave her mum's side to enter the group. When she came into the group, she had closed body language and posture. She didn't make any eye contact and she didn't participate with the group activity. She didn't stay for the full session, but stated she was happy she attended. As the weeks went on, A's mum would still bring her to the group. A would walk through the door independently, but would still require a member of staff to meet her at reception. She would, however, start making eye contact and joining in with the sessions. She has built her confidence and social skills up week by week and now walks into the group independently and socialising straight away. She joins in with the group and appears to really enjoy the session. A attends the Elevate workshops and enjoys the company of the group. She has made connections and friendships within the group and spends her time outside Elevate with some of the group. A admits sometimes it can be quite overwhelming, but she understands that she can take herself off for some quiet time when she needs to. So that's just one of the examples that we've got, and we're seeing obviously it's working quite well with our young adults and they're building that rapport with others.
Oh, that'll turn back on. Thanks. And I think that I think is a good indication of the fact that some of the particularly young people that we're working with and expecting to work with over the coming months are quite a long way from actually being able to see a job, apply for a job, get an interview, go and get a job. We want to support people who are like that, but we need to recognise that there are people with significantly greater distances to travel. So just a little bit about where we're up to in terms of current status, next steps. All the schemes are going to be live by the end of September, which is the end of next week. Yeah, so they're working with people, and one of the things, we had a session yesterday, we had 40 people in the room from all the different schemes, and buzzy, I think would be a good way to put it. Yeah. One of the things that's really heartening about all this, the level of enthusiasm and interest there is from all the people involved, and wanting to make new connections across the sort of work and health spectrum. And also people are looking for lots of creative ways to identify new potential clients, because we do know there's an awful lot of people who we haven't managed to reach in the past. Just on the collecting data and insight, there's a national evaluation going on of this, and there's a lot of requirements on each of the schemes to collect quite a lot of in-depth data about how they work, who they're working with. So over the coming months, we'll actually be able to share with people some quite detailed information about who we've been working with, what difference it's made, how many of those people have actually managed to get a job, and that's going to feed into the national sort of work about understanding this more in a more fine-grained way. A couple of things we need to focus on. More about marketing. There's more going on about that over the sort of next few weeks because all the schemes are actually live. We know we need to develop stronger links with businesses. Started already working with primary care teams through the primary care networks. And other local services, and we've been building strong links with things like talking therapies. So, just going back to the report, there were a couple of recommendations that we thought would be useful getting the board's view on, just to gain the board's support for the implementation of the Health and Working Life programme, but particularly to endorse that approach of taking a joined-up approach, because that is not happening everywhere. We are unusual, aren't we, Steve, in taking this approach to thinking about this as a whole, not separate things. So, done.
That's fantastic. Would you want to put your microphone, Phil?
Sorry.
Thank you. That's a brilliant introduction to all these fantastic things that are going on. I was lucky enough to see the Wellness Works launch in the rural area, which is my patch as a ward councillor, and it really was bringing some new people that I hadn't met before out of, into play in there, and then really great to hear a personal a case study there, because it does bring it to life for people. You mentioned a little bit about working with the employers and businesses. I'm really keen to see employers take this up. So when we've had a few questions, if people have got comments, I've got an ask for our board from you.
Hi, thanks for that. So my name's Catherine Riley. I'm from Calderdale and Huddersfield Foundation Trust. And so my interest particularly, we're an acute healthcare provider, but my interest is particularly as we're a massive employer, and we have lots of entry-level jobs. We have apprenticeships, we have project search, we do a lot of work in this field, and just to make sure that we're connected into what you do, because it would be such a shame for people to go through these programmes, build the confidence, but it not end in employment, and we might be in position to help with that. So just to make sure that we are connected in.
Do you want to just take Liz as well, and then come back to you?
Okay, hi, I'm Liz Mear, I chair the Kirklees Integrated Care Board Committee. Really great report, I loved reading it, great to hear it presented, great to hear the example, and we've got so much going on. So I read in the report that we'll feed into the regional and the national evaluation, but my question was about learning actually, because we've got so much going on and they're all so different. So how does each scheme learn from other places to improve and get more jobs created and support people into jobs? Can we do some learning from schemes that are the same nationally, and can we get that learning loop going so we get even better and better and get more people into work?
Do you want me to come back on those? So, Catherine, I almost gave somebody your name yesterday. But I thought that would be presumptuous. Yeah, because they've got a young person and they're desperate to work for the NHS. I don't think they're that bothered what they do. They just really want to work for the NHS. So, yeah, I know people are starting to make those connections, but I think perhaps, Steve, we need to pick that up through your group as well.
Sorry, yeah, I was just going to come in as well, because in the Calderdale and Kirklees Workforce Board meeting we had a few weeks ago, Rebecca Bowman came, who leads up your widening participation work. So as a result of that conversation, we've now started to make some direct links. So, for example, I linked her in with third sector leaders. So, yeah, we're looking to build on that kind of stuff. Yeah.
And just picking up on that issue about learning from other places, that is absolutely starting to happen. So there's a group that meets across West Yorkshire that normally Steve goes to, but I go to sometimes. And there's been various events that have been part of that to understand what's going on in the different places. And one of the characteristics of West Yorkshire, it being West Yorkshire, is all 5 areas are doing it differently. So there's something really useful in that. But there are some common denominators, and one of the things we've said at a West Yorkshire level, it's going to be important over the coming weeks to bring together the people who are working, for instance, with a bit like Get Set Goal, because in each of the 5 areas there's an organisation that's trying to work with employers to do that sort of work. And at the moment they aren't connected, but they need to talk to each other. And similarly, third sector infrastructure organisations are active in each of the 5 areas around the Accelerator programme. And again, what's going to happen is we're going to invite them to come together and share their experiences of how this is being picked up through the voluntary and community sector. And I think we've probably got quite a bit to learn from other places, because in some other places they've spent a lot more time focusing particularly on working with GP practices, because obviously that's where a lot of people go and get a fit note. So I think there's things we can learn from that, and certainly when I went to talk to the PCN clinical directors, that was one of the things they're obviously interested in, because they view the fit note process as not fit for purpose. Too many fits in that sentence, wasn't there? Anyway. Yeah. So there's lots we can learn from other places too.
Steve.
Thank you. Yeah, there was just one other thing I was going to mention as well. So one of the things that Phil has done is he's spoken to Healthwatch Kirklees. So they're going to do some work for us as well about understanding how easy these offers of support and other existing ones are for members of the public to actually access. So, you know, how easy is it for them to find them, how easy is it to engage, how long does it take, that kind of stuff. So we're conscious that we've tried to do a lot of work in here to make this make more sense, but we're also mindful that it doesn't need to just make sense to us, it needs to make sense to the public. So, yeah.
Lucy.
Thank you, that's brilliant. I think the first thing is to say, like, well done, because I know it must have taken a huge amount of work to get all of that set up since April. I had a question, I think it relates to Steve's question around all the data you said you're gathering. There's a lot of data that's kind of going back up nationally. And I think hearing your case study was really helpful. How will you also ensure the kind of quality of what's being delivered, and is there like plans to do other like similar kind of gathering of qualitative feedback as well as the quantitative stuff as well?
Is yes enough? That's going to happen at the 3 levels. We're doing many things. So we've said as a wide team of people who are actually delivering it, that collecting case studies and sharing that with each other and reflecting on those, and we've got a sort of quarterly routine of bringing people together to look at what we're doing and reflecting on that. So it's going to happen at a Kirklees level. Similar work's going to happen at a West Yorkshire level, because they're trying to understand what the similarities and differences are across West Yorkshire. And the national team have commissioned Rosenet to do some specific qualitative evaluation of the overall programme. So.
Anyone else? So what I'd like to ask now, Phil, is as a board made up of big employers for a large part, is there anything we can do to support you in this work? Because I love the idea, we've got the pincer movement, you know, the health and adult social care focus at the older end, the youngsters. I mean, health and social care workers are 1 in 5 of our working population. Keeping them in work is great. Getting the youngsters into work. But, you know, employers' end of it, I don't know. I know Steve just referenced the Kirklees and Code of Workforce Board. If that brings together the employers, have we got a raft of ethical, motivated employers that are prepared to work with the young people maybe a little differently? People need different ways of working that I know, you know, Liz and the uni have looked at certain areas of way people can work. We're missing out on skills because simple adaptations and supporting work would help with that. How can we as a board support you, and how can we take that message back out to the places that we all represent?
I'll answer on that if that's okay. So we, within the council, are managing the trailblazer element of this, so the funding coming via WICA. And part of that money that we have for this year is to look at peer networks, and one of the peer networks we're very keen to establish within Kirklees is for inclusive employers. So anybody that would like to be involved as an inclusive employer, that would be amazing. But that is something that's about to get off the ground. So we're doing desktop research at the moment on disability confident employers, etc. So yeah, if anybody wants to give their details for that, that would be amazing. Thank you.
Just to build on that, so one of the things I know that the Mayor is really keen to do with the Healthy Working Life programme is to make sure that it's connected to the Good Work Charter. So we've got things like the top 100 companies, and I know colleagues at the university are using that as a starting point for who to go and talk to in terms of businesses, and they're working with the Chamber to make some of the connections that they haven't already got. But like I say, the Mayor's really keen to make that connection with the Good Work Charter, so we've already started conversations about how to go from somebody signed a charter, and when you read the charter, it's clear that supporting people to stay in work if they've got health issues, or supporting people to re-enter work if they've been out of it because of health issues, fits so well with the Good Work Charter. So I think that's one opportunity, pushing the Good Work Charter, but then also pushing it in a way that says, and actually connecting with the Healthy Working Life programme means you can actually start to make that a real thing rather than just because all organisations have been there, haven't they? They've got something up on the wall and it doesn't actually make any difference to what in practice the HR department does on a day-to-day basis, and this is an opportunity to do that.
Yeah, Liz.
There's an organisation that's not active or connected into Kirklees at all that I'm a regional board member of, ironically. We are members, the university are members of Business in the Community. They're very active in Sheffield and in Bradford. And as a regional board member, I've told them they need to get their act together and actually engage in Kirklees and in more depth. So I'm looking at potential businesses that are employee friendly and inclusive. But I think one of the things, and they're really keen to do that. So one of the pieces of work we've done with them research-wise is around neurodiversity with businesses and understanding how, because a lot of HR teams don't really understand how to manage and what you can simply put in place for people who are neurodiverse in the workforce. So a framework's been developed, that's been published nationally, so it's a national organisation, it's a big deal really. And for what we're doing in Kirklees and our agenda around the health and well-being, they need to really be seen and visible. And I've told them they're not. So I think it would be really good if I could introduce the Business in the Community team to yourself, Phil and Steve, and yourself, because one of the examples is the framework that's been put together and published nationally around supporting neurodiverse employees and all the workshops we've done with business. One of the ideas was actually having trained those companies to actually take them into schools, to actually talk to kids that are neurodiverse, to say, look, we are employers, we understand what you need. Because once they've gone through this training that we're doing with them, they get it. And it's not super complicated, but they just don't understand. So Business in the Community are really, really keen on that. And, as a national organisation, to not have visibility in our patch, I think is shocking, really. So they want to do it. So if I could collaborate with you on that, that'd be good.
That sounds fantastic. It's something I was just coming to talk to. I was good to bring that out as well, that the employers, we need that pincer movement. You're working with people, employers can't deal with something, they can refer someone to you, but actually better if they're dealing with it in-house already, if there's a way to collaborate on that.
Yeah, I can pick up on that. So we are working very closely with Business and Economy team service within the council, and it is a colleague from Business and Economy that's looking at setting up this inclusive employer network. In terms of that, we definitely would be interested in that. We have some really good advocates within Kirklees. I have to do a shout out for Callum at Nando's in Huddersfield, who has been such an advocate for our local supported employment programme and taking on young people that are neurodiverse. It's been quite incredible, the achievements that he's made within Nando's, so much so that he has actually been seconded into DWP to support on the Connect to Health, Connect to Work programme, specifically looking at the supported employment quality framework element of the programme. So, you know, we do have like individual pockets, but that would be amazing to link in with them. Thank you very much.
Fantastic, making connections and working as partners, it's what we're all about here, isn't it? So where do we, if as an employer, with an employee who needs help that they can't give them to keep them in work, if somebody's out there in the community wanting some support to get over that hurdle into work, where do we find a place to refer them or for them to refer themselves for?
So I mentioned the website where we've put all the information, and there's a link in I'm pointing at it like it's there and it's not. Yeah, so there's a website that's got basically a summary of all the sort of offers, and one of the approaches we've basically adopted was sort of no wrong front door. So if anybody contacts, I don't know, it might be Careers, and says, this is my situation, I blah, 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 Careers will know what the other options are and think, well, if it's not us, we know who it is who can support you. You know, if you pitch up at the front door of Brian Jackson House, the same thing would happen. So it's very much a no wrong front door, and all those partners who are listed on the website and who I've mentioned today would be the best place to start.
Great stuff. I would say well done, and a great start there. Long may the good work continue and the continued funding. Thank you. Sorry we're a little late coming to you. You may expect it to be early. So what we'll do now is we'll just go back to Vicky, and if anybody's got any questions connected with the update on the changes to the ICB and the health agenda, you can put them to her now. Did that resonate? It was very comprehensive, Vicky, so I think you gave us a lot of food for thought to take away there, and you know, keep plugging away. We have already discussed earlier how you've got your Healthy Neighbourhood plan coming forward, and we will put in a workshop session in December to be able to work with you on that from the Health and Wellbeing Board. So members, please look out for that coming through on your inbox, and we'd like as many people representing as many different partners as possible on board for that. Meanwhile, that's everything from today's board, and thank you very much for coming.